Good afternoon and welcome to the City of Toronto Media Briefing. Today is February 1st. First up is Mayor John Tory. Go ahead.
Well, good morning. We are now into day one of the provincial reopening, and it's great to see our progress in helping residents get vaccinated is paying off, and that restaurants and gyms have reopened and that people can resume, at least in part, some of their normal routines. And I want to thank Team Toronto for helping to get those third doses ramped up in the face of the Omicron surge, which I think we did very well as a team effort, and for helping millions of residents to get vaccinated. 58.8% of eligible residents now have their third dose, 54% of kids 5 to 11 have at least one dose of vaccine, and 23% of kids have 2 doses. Our Team Toronto Kids COVID-19 vaccination plan has worked to help deliver more than 158,000 vaccine doses for kids in a 2-month period. And that work is continuing, and both Dr. Davila and Councillor Cressy will outline some of the next phases of the plan to make sure that we are making the effort and, in fact, are helping every kid everywhere in our city without exception to get vaccinated. This helps to protect those kids, but it also helps to protect the progress we've made in getting back to in-class learning. In our daily meetings on vaccination progress, I've been very clear that we must continue the good work we have done because it has been something that I think has been exemplary, I think it's been a model, and I think it's been successful, most importantly. And that's the work we've done with community organizations, with community ambassadors to help drive up vaccination rates in all areas of the city and to make sure that we continue to do everything we can as a city, along with our Team Toronto partners, to deliver vaccinations to all neighborhoods across Toronto. And I've been heartened as I visited clinics in all parts of the city, including places where there is under-vaccination, to have people tell me that it's because an ambassador knocked on the door or because of a familiar face from a health clinic that they came to get vaccinated. So it proves to me anecdotally and otherwise the system is working, and we have to be patient and stay at it, and that's part of what Councillor Cressy will address today. I want to mention specifically and thank the Scarborough Health Network and its partners for the outstanding vaccination efforts they undertook this past weekend. More than 5,100 doses of vaccine were administered during Scarborough Health Network's Family Roll Call Vax Weekend. This is great work, and it's another example of teamwork and of taking initiative, focusing on areas that have under-vaccination and getting the job done. And these are the kinds of efforts that are continuing across the city. The pandemic has not slowed down the city's progress in modernizing itself and digitizing service delivery. In fact, in some respects, it has given some renewed impetus to this. While we continue to deliver essential and critical services, we also made many advancements in digitizing a number of city services and providing more self-serve options for people. And this will be something that will last beyond the pandemic as a benefit to people. Last week, we announced the launch of our new 311 mobile app. Today, I'm pleased to announce the launch of My Toronto Pay, which is the city's new digital payments service. This new service offers property owners an online option for paying and managing property tax and utility bills. Today's announcement is another step forward as part of the city's ongoing investment in service improvements to provide residents and businesses with access to services where and how they wish to access them. As part of its service modernization, the city is committed to ensuring service equity, accessibility, privacy, and security, and offering simple and modern digital options that can also lead to more efficient operations on our end. My Toronto Pay provides convenience and flexibility to residents and businesses by providing secure, easy-to-use, and accessible options for making payments. And it also offers many benefits, such as being able to pay your bills in one secure location, scheduling future payments, seeing your transaction history, saving your preferred payment methods, and getting reminders so that you never miss another payment due date. Payments can be made by electronic funds transfer, EFT, for no fee, by Visa or American Express credit cards, where a fee of 2.35% of total payment amount is passed along, or by debit card, a fee of 1.5% of total payment amount. The city partnered with Payit, a leader in digital government service and payment delivery, to launch this digital payment service. This is just the beginning of the journey for My Toronto Pay, with changes and expansion of service options to come in the very near future, more features and payment-related services coming in the coming months. It's also important to note that launching this new service also drives cost savings and efficiencies for the city's operations. City staff estimate a return on investment of $11 million over the first 5 years of this MyPay being available to the residents. I'm incredibly proud of the work that has gone into transforming and improving access to city services despite the pandemic. And in some cases, we've speeded up different changes and transformations that were being made and the availability of virtual services for people so that they can have a modern, accessible customer experience even during a circumstance such as a pandemic. We are making progress in getting through this pandemic together. This is a big week for our city and for our province as we all move forward together to some of the next steps that we all want to take along the way. It is good and welcome progress, especially, of course, for restaurants and other businesses who've been adversely affected by the restrictions. For our restaurants in particular, it is more important than ever that we support them. And that means dining local. We talked in earlier weeks about taking out local, and I think people stepped up to respond to that, and I thank you for that, as I'm sure do the restaurants. Now it is time to continue to take out local, but also where you can and where you're able to do so, to please dine local and support these businesses that are digging themselves out of a hole created over quite a lengthy period of time. Team Toronto worked nonstop throughout the Omicron surge to help people get their third doses so that we could get through this period as quickly as possible and so that we could get back to the progress that we were making, which you'll recall wasn't that long ago, on the reopening. This has ensured the efforts we've made on third doses and everybody getting those numbers up on vaccinations, that the province can move ahead with reopening, which did start yesterday. That is good and welcome news for both people and for businesses. And now we have to continue to move forward and continue to create the conditions that can cause the province to move forward, which starts with vaccination, although it doesn't end there, because it also includes continued respect for public health measures that are in place and just good old-fashioned common sense in terms of dealing with this very transmissible virus. We have to continue to move forward safely and cautiously, but move forward nonetheless. I know people are doing whatever they can to support restaurants and other businesses, and I know that by following public health guidelines, continuing to get the remaining people vaccinated, we will provide further support and further impetus to our moving forward to the days that we all want. As a city, we will continue to do everything we can as a city government to keep supporting restaurants and all businesses, and that is why we are cutting small business property taxes by 15% as part of this year's budget, and why we'll be doing all we can to encourage people through different programs to visit and support local restaurants and to really support our main streets as a whole, including other retail that have also been hard hit by the pandemic. I think that as we go into February, into this month, it is important to maintain that cautious optimism. Optimism, but cautious optimism, safe optimism that we have made progress and we can continue to make progress if we stay the course. It isn't just a matter of, declaring everything open all of a sudden. It's a matter of staying the course and making gradual but steady progress. I'd now like to invite Dr. Davila to offer her remarks for today.
Thank you, Mayor Tory, and good afternoon. We continue to see signs that the Omicron wave is subsiding in Toronto across numerous indicators. Although provincial COVID-19 testing guidelines mean that not everyone can be tested and that case counts are surely higher than what we are able to report, it is nonetheless encouraging to see that the daily average number of cases continues to decline. Over the weekend, Toronto averaged 686 daily cases, which is down from 1,123 the weekend before. Likewise, the number of active outbreaks in healthcare settings has declined from 178 on January 24th to 144 on January 31st. While there are still large numbers of patients with COVID-19 in hospital and in intensive care, new admissions appear to be slowing over the past week. I want to offer my deep gratitude to the healthcare workers, public health staff, and essential workers who have not ceased in their efforts to provide care and support to those in need while working through this very challenging time. These are encouraging developments we're seeing in the indicators of COVID activity, and they are directly attributable to the efforts that Toronto residents have made to reduce the impact of COVID-19 by getting vaccinated and continuing to follow public health measures as Omicron has surged in our community. To everyone who has stepped up and done their part, thank you. Yesterday, the province removed a number of restrictions as part of its reopening plan. As in-person contacts increase in the coming days and weeks, this gives COVID-19 greater opportunity to spread. So in order to support a successful reopening, we must remain vigilant to protect the progress we've made together. The COVID-19 vaccine remains one of the most effective ways to protect yourself and others. The evidence shows that for those 18 years of age and older, 3 doses of vaccine offers maximum protection against severe outcomes from the highly transmissible Omicron variant. Similarly, vaccination for 5 to 11-year-olds offers important protection for our children, for schools, our families, and our communities. Toronto Public Health and our Team Toronto Kids partners have worked tirelessly for 10 weeks since the vaccine first became available and throughout the Omicron surge. And so far, we have delivered about 158,000 doses to children aged 5 to 11. I am especially grateful for the support of Toronto school boards and schools to maximize vaccination and outreach opportunities for school-aged children and youth, parents and guardians, teachers, and essential education workers. Team Toronto has held 436 school-based vaccine clinics since the end of November. This includes the 90 school-based clinics held in the past 2 weeks alone, and there are dozens more planned for the weeks ahead. And as many parents continue to bring their children forward for vaccination, we know that some parents have questions about vaccination and have not arranged to get their children vaccinated just yet. If you are one of these parents, I encourage you to seek out a trusted healthcare provider and get your questions answered. While children are less likely to get really sick from COVID-19, they can still develop serious complications from a COVID-19 infection. Even kids who have really mild initial infections can have long-term effects which can impact multiple parts of the body, including the heart, the lungs, the brain, and the eyes. These are rare, but serious, and can require hospitalization and even an ICU stay. And even if kids don't show symptoms of COVID-19, they can still spread the virus to their family and other people around them. COVID-19 vaccines are safe, effective, and the most closely monitored vaccines in history. In Canada, all vaccines are tracked and monitored for any side effects and their effectiveness. It's normal to have questions about vaccines you're considering for your children. Please speak to a knowledgeable healthcare provider you trust who can help you make decisions about your family's health. At Toronto Public Health, we will continue to work with all of our vaccination, healthcare, and community partners to bring vaccine to children and all others across the city. Finally, as outlined today by the Ontario Science Table, as we move through reopening, we should expect to see some rise in COVID-19 activity, including hospitalizations and ICU admissions. And while we can't eliminate COVID-19, we do have some control over the impact that the virus has on our lives. Vaccination makes a difference. Masking and physical distancing make a difference. Limiting the number of in-person interactions we have and staying home when unwell make a difference. Together, through our focused individual and collective efforts, we can control the spread of COVID-19 and continue to rise to the challenges before us. With that, I'll now turn it over to Councillor Cressy to deliver his remarks.
Well, thank you, Mayor Tory and Dr. Davila. Today, I'd like to tell you a little bit more about our Team Toronto Kids 5 to 11-year-old vaccine campaign. 10 weeks ago today, we administered the first pediatric vaccine in Canada. Alongside Sick Kids Hospital and with superheroes and stickers and animal paw prints and even a coloring station, we launched with that very first shot. This was before Omicron, and it was before our accelerated third dose booster campaign, just 10 weeks ago. Now, since then, Team Toronto Kids has continued nonstop. And just like our overall vaccination campaign, which is now over 90% for first doses for those over the age of 12, Team Toronto Kids is a marathon at a sprinting pace. And to carry on that analogy, with 5 to 11-year-olds, we've passed the halfway mark. Now, in the last 10 weeks, as Dr. Davila noted, Team Toronto has administered 158,000 doses of vaccines to kids 5 to 11 years old. 54% of 5 to 11-year-olds have their first dose and 23% have their second. Our multi-pronged clinic model has included city-run mass immunization clinics, hospital clinics, pharmacies, family doctors, and school clinics. And thus far, a little more than 50% of the kids' doses have been administered at mass immunization clinics. Now, we know that education and outreach is critical, especially for parents and caregivers. To that end, thus far, we've hosted 140 webinars for parents and caregivers, 2 telephone town halls for 101,000 participants, and our partners at Sick Kids have held more than 1,100 individual consultations with parents and caregivers. And just like with our first dose campaign for adults, we've been working to bring vaccines directly to where people are, in this case, directly to schools where kids are. And as Dr. Davila noted, thus far we've hosted 436 school-based clinics in 38 targeted neighborhoods where vaccine rates have been lower and COVID rates have been higher. And so overall, take all this together, we're off to a really strong start, and we're pleased with the progress, but there is more work to do. And just like with the adult vaccine campaign last summer, with kids, we've entered a new phase. This is the hyper-local phase. And so here's what that looks like. In the last 2 weeks, we accelerated school-based clinics and we increased direct outreach to parents and caregivers in targeted neighborhoods. And in those 2 weeks, 90 school-based clinics were held, and we partnered with the Toronto District and the Toronto Catholic District School Boards to ensure that parents were called, texted, and emailed in advance of those school clinics. And it's working. So let me paint the picture. In the last 2 weeks, for example, in Rexdale, in Malvern, and in Scarborough Village, in those 3 neighborhoods where we focused, we saw kids' vaccine rates increase by more than 5%. 5% increase in 2 weeks in some of our targeted neighborhoods. That compared to a citywide neighborhood average increase of about 2%. Now, not to get lost in the numbers, this is what a successful hyper-local strategy looks like in this phase. It's local, it's targeted, it takes effort, and it can take time, but it works. You know, our 12 to 17-year-old vaccine campaign took 24 weeks to reach 90% of teens with the first dose. And we got there because we never stopped. School by school, kid by kid, we build trust and we break down barriers. That's the Team Toronto way that Mayor Tory always describes. So what's next? We're continuing to accelerate this hyper-local approach. We have 57 clinics planned in schools over the next 2 weeks. We're continuing to scale up outreach to parents in targeted neighborhoods, working really closely with the school boards. And we're building off the success of recent big events we held, like Vax the Northwest and the Family Roll Call Weekend in Scarborough with Scarborough Health Network, with planning underway for more big events throughout February. And so let me close with this message. I remember at the 10-week mark of the adult vaccination campaign last spring. At that time, nearly everybody told us we couldn't possibly reach 90% vaccine uptake in a city like ours. But we did it because Torontonians stepped up. In a city with 3 million people, with 200 different ethnocultural groups where 180 languages are spoken, Torontonians rallied together to protect each other. It truly has been an incredible act of unity. And just like that adult campaign, Team Toronto Kids will get there. This is a marathon, and we have the tools, we have the team, we have the plan to reach every kid everywhere, and we're going to continue to do just that. With that, I'll turn the floor over to Lavin to open it up for questions.
Thank you. We will now take questions from the media. As a reminder, it's one question, one follow-up. We will unmute you when it's your turn. We do also have staff on the line from Transportation, Solid Waste Management, Shelter Support and Housing, Technology Services, and Revenue Services if you do have any specific questions. First up, we have Felipe from Radio Canada. Go ahead.
Hi, my question is for Mayor Tory. So City Council will be voting tomorrow on a motion asking the province to implement a speculation tax and a home flipping tax. So do you think that these policies would actually help cool off the housing market? And even if the motion is approved by City Council, how confident are you that the Ford government will look at implementing such taxes?
If you look at the foundation of all of the policies we've adopted in terms of trying to improve the availability of housing, including affordable housing, a lot of it has been with a view to placing first the notion that people are to live in homes and homes are for people to live in. And so I think that these kinds of measures, and we're asking the province through this motion to consider a speculation tax of this kind and these kinds of measures, because we believe that it's all hands on deck in terms of taking that fundamental premise, which is that homes are for people to live in, and making sure you can place that at the top of the priority list. Homes are for people to invest in as well, but you can never let the financial aspects of this surpass the obligation that we have to find more homes for more people to live in, hopefully as affordably as possible. So it is something that I think is a worthwhile signal for us to send as a City Council, given the challenge we face in terms of finding housing for people in our city. It is for their consideration, and I think that they're looking too for different ways in which we can make sure as many housing units are available to people as affordably as possible, and these are two of the ways that Councillor Cole has identified that might be examined, and I'm supporting the province having a look at those.
And how confident would you say that you are that the Ford government will actually look at those tax options? And does the fact that it's an election year come into play in this?
I don't know whether election year has any impact on these things. We've already put a vacant home tax in place ourselves, and I think that's going to be a step forward, again, on the theory that we need homes for people to live in. As many other purposes as there may be as an investment vehicle and things like that, we need people to be able to live in these homes. I think that the government, through its summit that it had a week or so ago, the reports that it's commissioned and so on, has indicated its interest in looking at a wide variety of measures to make sure that we have as many homes as affordably as possible for people to live in as possible. And so I'm sure they'll take a look at these things alongside many others.
Thank you. Next up, we have Jennifer Pagliaro from The Star. Go ahead.
Hey there, good afternoon, everyone. I just wanted to start by asking Dr. Davila a question. Dr. Davila, I wanted to know, it seems like we're kind of at this point where vaccines are, for the most part, widely accessible for kids and adults. And there seems to be a recognition that we can't simply keep people locked down and businesses closed. And so I'm just wondering, given the numbers that you've seen, are we really relying on, individual residents to keep each other safe, keep their families safe? Are we at that point in the pandemic where, the time for a government intervention is maybe on the back burner here?
Jennifer, that's an interesting question. Let me see how best I can provide you with a response. I would say that you'll have noted throughout the course of the entire pandemic that we've had to adjust and change our responses along with changing circumstances. And of course, informed by the science, which also has evolved over the course of the pandemic. So, I think that at this point in the pandemic, you're continuing us to see, to see us, I should say, deploy the best available science in order to provide the best response, to what we're seeing on the ground. What we've seen as of late is with the arrival of Omicron, we have this incredibly transmissible variant. And that, perhaps, the goal of elimination isn't really within reach. But what we have is the lessons we've learned over 2 years now. And we have some very, very effective tools. We have vaccine available to us. And, while you can say that vaccine is widely accessible, our experience on the ground has been that there are still some challenges for people in respect of accessing vaccine. Hence, you see us use that very hyper-local method that Councillor Cressy just spoke of in order to make sure that we're reducing barriers as much as possible. It took us some time to get to 90% of our 12-plus population with 1 dose of vaccine on board. We're going to continue our efforts to keep driving up vaccine coverage to make sure that as many people as possible are getting that protective benefit of vaccine. You've also seen Torontonians step up over the course of the past 2 years with respect to practicing good self-protection measures, and we know that these still work. So as far as I'm concerned, we do know that there are tools we have in our toolkit. I think it's beholden on all of us to use the tools as best we can, and to my mind, it's a combination of both individual and collective efforts that have gotten us this far. And I think it's going to be the combination of those two kinds of efforts that will continue to see us well into the future.
And just given the numbers you've seen, I know you said, I believe last week, that it was difficult to say whether we've seen Omicron peak at this point. There's some new numbers out today, new data available to you this week. Would it be fair to say that the worst of this wave is behind us, acknowledging obviously that a reopening brings some risk of increase, but hopefully not a substantial amount?
Well, Jen, I think you've hit the nail exactly on the head. We've certainly seen positive indications of declining COVID activity, as I've discussed today in the remarks. Hence, I've described my feeling of cautious optimism. We have reason to be optimistic because our indicators are moving in the right direction. But just as you mentioned, with reopening, there is more opportunity for COVID spread to happen within the community. The good news is we have really effective tools available for us to use. So whether we're talking about vaccination or we're talking about the use of self-protection measures, things like masking, physical distancing, ventilation, all the things that we know actually make a difference to reduce the spread of COVID-19, those in combination with vaccination are the kinds of things we need to continue to do in order to see our progress be sustained and maintained for the long haul.
Councillor Cressy, I believe you have something to add to that.
Well, Jennifer, I just wanted to add that Eileen spoke of cautious optimism, and I think the reason for the most significant optimism remains vaccines. The vaccines have proven to be effective in protecting against harm from the Omicron variant. And the reason to be optimistic beyond that is that Torontonians continue to step up to do their part to protect themselves and each other with vaccines. We've approached nearly 60% already of those eligible with a booster dose already. And that's in addition to over 90% of those over the age of 12 having already got their first dose. And so that's a reason for profound optimism, because Torontonians have done their part, and because of that, I think the path forward is a safer one. And so we should all be optimistic for that reason.
Okay, that's it for today, everybody. Thank you and have a great rest of your week.